Here with Congressman Anthony Weiner and Scott Garrett. We heard from them earlier. They were web chatting for the last hour. All right, Congressman, so what's the most popular question you're getting?
How is this going to affect me, or how is this going to help me?
Okay, and then you got to narrow it down. Obviously, It depends on who you are. So,
well, I'm getting a lot of questions, Congressman Weiner, how did you become so great? But there are a lot of questions about who's covered by the plan and who's not. The main thing I think a lot of citizens need to realize is that in most cases, if you have insurance through your employer, not only can't you lose it, you can't even jump and try it to the alternatives for 5 years. So for most people, this is not going to have a dramatic effect, except we hope what it'll do is control the cost of health care overall, and I think that's something we have to do.
Is it, though, I think a lot of people ask this question, how is it going to impact taxes? So maybe you don't need the health care plan because you're covered by your employer, but then are you going to be paying for everyone else to get covered?
And I think that, matter of fact, was the last question that I just got, and who's going to pay for this at the end of the day, and where does the money come from? And I think the question was, how does this affect the middle class as far as taxes goes? And that's a real concern, because really there's nothing in the bill that we're looking at that's actually going to bring costs down. And the CBO said, the Congressional Budget Office said just the opposite, that you're looking at over $1 trillion basically in added cost to the overall system. And the system right now is going almost bankrupt as far as all of our entitlements, Medicare, Medicaid, and what have you, and we're just adding that extra burden onto it. So it comes from the taxpayer at the end of the day. Well,
it's a very common, what Congressman Garrett has, a very common misconception. The fact is we're paying for these people today, but in the most inefficient way possible. $3 billion in extra taxes here in New York City to cover the uninsured and underinsured. Those taxes, theoretically, if we cover everyone, you won't have to pay them anymore. The fact is we pay for people when they walk into a hospital emergency room with no coverage, but we do it in the least efficient way possible. That has to change.
But will we be paying more under this new plan?
Well, that's what CBO says. Congressional Budget Office looked at it, and the idea was, I think everybody wants reform, and everybody wants to try to bring down the cost, but this says we will be paying, we're paying X now, we are paying for people who go to the hospitals and what have you, who don't have insurance right now, but we're going to be expanding that coverage, we're going to be expanding that, and we're going to be spending what CBO says, another $1 trillion on it.
Yes, except CBO forgets one thing. We're going to be paying less in our cities and our states, and less for products that we purchase that have health insurance built into it. That's going to be less. Overall, citizens are going to pay less money, particularly here in New York City, where we absorb an enormous amount of cost for the uninsured and the underinsured that we have no choice but to cover. Now it's going to be covered in a more comprehensive way.
All right. Congressman, thank you very much.